I'm Carl May. I'm Professor of Medical Sociology at the University of Newcastle in Northern England, and my work's been about medical communications and telemedicine systems and telecare systems and how they mediate human interaction. So I'm interested in the ways that technological innovations can be used to convey very complex clinical problems and clinical solutions across healthcare systems that in the world that we live in now are under tremendous pressure and tremendous fiscal stress. I think one of the things that's so impressive about the Mayo Clinic's social media program is how closely it accords to the values of the enterprise, the richness and the enthusiasm of the people who work for Mayo, and how carefully put together the whole package is, so that Twitter, Facebook, YouTube and a whole variety of social media applications get put together in one whole package with a consistent message about excellence and interest and enthusiasm, and most importantly without affectation and without being super polished, so that every time we see a Mayo video on YouTube it conveys an unaffected, sensible, gentle and unhyped account of the work that's being demonstrated, the clinical practice that we're seeing, or the research outcomes that are being spoken about. So that's my kind of view from across the water of how Mayo has presented itself, using what are for many organisations technologies that are full of risk and danger, and the trust in the system that Mayo evinces, the idea that, well, a video doesn't have to have been produced in Hollywood to be useful, and in fact it's probably better that it wasn't, since it speaks directly to the person who's going to read it or listen to it or hear it. In the autumn of this year I'm moving to the University of Southampton in the south of England, where I'm going to be Professor of Healthcare Innovation and Director of Research in the School of Health Sciences. So I'm full of enthusiasm for the work that Mayo does, precisely because it manages the difficult tension between innovation and the capacity to speak in a human way